Hello Enid, this is Diana Hernandez coming to you from Garfield County Health Department. We are going to jump right on in, got lots of stuff to cover. And from the Oklahoma State Department of Health, what you need to know. On July 3rd, a news release was sent out. OSCH WIC program seeks public input from Oklahomans for the 2024 federal fiscal year. The Oklahoma State Department of Health's Women, Infants, and Children WIC program is asking for input from individuals about the special supplemental nutrition program's operations. Information shared with WIC will be considered for the state plan of program operations for 2024. In order for comments to be considered, they must be received by August 1st, 2023. WIC serves every month 70,000 Oklahomans that participate in the WIC program. WIC is a federally funded nutrition education supplemental food program for low-income, pregnant, breastfeeding, and postpartum women, infants, and children up to the age of 5. Eligibility is determined by nutritional risk and income that falls below 185% of the poverty level. Comments may be submitted electronically or by letter to the Oklahoma State Department of Health, Attention WIC, Service 123 Robert South Kerr Avenue, Suite 1702, Oklahoma City. Or you can visit their website as well. But we also have this shared on our Facebook page, so you can just hop over there and get that information. OSDH does encourage families to think about getting ready for back to school. This summer winds down. The Oklahoma State Department of Health is reminding families to start thinking about records they may need for their kids going back to school. Birth certificates can be ordered online or by calling 800-77-817-7364. Requests from a parent named or on the record are typically issued in 2 business days and arrive in the mail typically within a week. This is information that typically you would want to know once you start embarking on where do I get my birth certificates and is there a fee? And there is a fee. Costs for ordering birth certificates or changes to birth certificates are as follows. Birth certificate, there is a charge of $15 search fee. The fee is per copy issued. The search fee is non-refundable if the birth certificate is not found. Additional copies are $15 each. Change or amendment to the record is $40. That includes $15 search fee and a $25 amendment fee. Online phone convenience fee is $5 for the Oklahoma residents and it varies for non-residents. Online phone expedites fee is $20 and that is applicable. Records that require a change or amendment are not eligible for expedited services. And if a parent or guardian needs to get a child's shot records, those can be found online through the Oklahoma Immunization Information System, OSIS portal. To obtain shot records through the portal, you must have the child's name, date of birth, and the contact phone or email on the child's shot records. If the records are not on OSIS, you can contact the OSIS help desk by emailing osishelp@health.ok.gov, or you can reach out to the provider who administered the shots and ask them to update OSIS, or just reach out to us at the health department. We'll be happy to assess. And another news release was sent on July 20th. OSDH shares information on increase of cyclosporiasis in the United States and in Oklahoma since May 2023. The Centers for Disease Control and Prevention, CDC, the Food and Drug Administration, FDA, and local and state health officials have been investigating an uptick in cyclosporiasis cases nationwide, including in Oklahoma. Cyclosporiasis is a diarrheal illness caused by a single-cell parasite and is spread by consumption of contaminated food or water, which becomes contaminated after exposure to fecal matter from ill individuals. Cyclospora is not known to be spread person to person. We have some cases increase here, but we don't want people to panic, said the state epidemiologist Jolieanne Stone. Our goal is to share information with Oklahomans on how they can work to prevent potential illnesses and what to do if they start to feel sick. To help prevent illnesses, individuals should wash fruits and vegetables thoroughly, practice good hand hygiene, and avoid handling food if ill with diarrhea. The Oklahoma State Department of Health encourages individuals to contact their healthcare provider if they experience symptoms of cyclosporiasis, which can include watery diarrhea, loss of appetite, weight loss, bloating, stomach cramps, nausea, vomiting, muscle aches, and fatigue. These symptoms typically appear 1 week after exposure. We are currently encouraging healthcare providers to think about testing patients for cyclospora. If a patient has any of the symptoms listed above, especially watery diarrhea that has persisted for over a week, said Stone, there is a treatment for this, so if someone is diagnosed, they will work with their doctor to get medication. The OSDH is actively working with the CDC and FDA to investigate what may be the cause of the illness. For more information on cyclospora, you can visit oklahoma.gov and search cyclosporiasis. And from the Garfield County Health Department, mosquito season is in full swing, and we want to remind families of tips to help avoid ailment spreads by insects, including West Nile virus. Tips to avoid mosquito bites and prevent West Nile virus infections: use an insect repellent containing DEET, picaridine, IR 3535 on exposed skin and clothing when going outdoors, particularly between dusk and dawn when mosquitoes are more likely to bite. Insect repellent and permethrin should be used on clothing only. Repair or install window and door screens to keep mosquitoes out of home. Prevent items such as buckets, cans, pool covers, flower pots, children's toys, and tires from holding water to minimize mosquitoes' breeding grounds. Larvicide can be used in areas where stagnant water cannot be eliminated to prevent the larvae from maturing into biting adults. Empty pets outdoor water bowl and refill daily. Clean leaves and debris from rain gutters and regularly to ensure that they are not clogged. It is UV Awareness Month. Get the sunscreen on when you are outside. Here are 3 tips to look for when choosing a sunscreen: at least SPF 30, water resistant, broad spectrum. When outside, remember to cover up, seek shade, wear sunscreen, and regularly check for changes in your skin. This can help reduce the rates of skin cancer, including melanoma. If you are headed to the lake this summer, be sure to check current conditions and monitor algae and bacteria symptoms called blue algae. These bloom and can cause a variety of symptoms if touched or swallowed. To check lake conditions, visit travelok.com state parks/lake-conditions. And of course, we have programs and services worth bragging about. We have our pediatric audiology for ages birth to 18. No referral is required. We have a Sooner Start for up to age 3. No referral is required. We have Children First, designed for first-time moms. We have a WIC, a food supplemental program, and a big advocate for breastfeeding. And next week, from August 1st to 7th, is World Breastfeeding Week. We are excited to invite all WIC breastfeeding, pumping, and pregnant participants to our World Breastfeeding Week celebration on August 2nd. It is located at Garfield County Health Department, 2501 South Mercer Drive, from 11 a.m. to 12 p.m. We have an awesome hour prepared. There will be door prizes, refreshments, an infant soothing demonstration, and of course a baby scale available for use. The event is posted on our Facebook page, so if you want to hop over there, you can check it out. And of course, find us on Facebook. And if you've made it to the end of this community health update, thank you for sticking with me. If you like more health-related tips, health-related content, just hop over to our Facebook page, Garfield County Health Department. And if you're not already, hit that follow button and stay up to date in between community health updates. Until next time, stay cool, stay healthy, and stay safe. Bye.